My name is Dr. Kerr Fisnick. We're live and on the air. And, for those of you that are listening and on Facebook with us, give us the old thumbs up. Give us a smiley face, the heart. Let us know where you're from. We're excited. We have a great call, as you can see from the panelists that we have on here tonight. We've got a lot of great testimonials. We've got some other ones that we had to pre-record. And, I'm telling you what, if you want to hear some stories of people that have had better health and maybe some life-changing events, you're going to hear some of them as well. So hang on, bear with me. We're going to get this thing going. I'm going to launch with going down to my friend Jessica down in Utah. Jessica got started, I think it was 2 years ago you got started, wasn't it, Jessica? Hang on one second. I think, there, you're unmuted. And share your story. What's been happening down in Utah?
Well, when I got started, I was looking for some pounds to get rid of, not to gain, that's for sure. And I had started, I was introduced to Sisel a while back and just through life circumstances got out, and I shouldn't have, but I did. And I came back, thankfully, because their products are absolutely the best. So I started with the weight loss program. We had some different products then that helped with metabolism and fat fighting and all that. So the accelerator for Skolin, which we don't any longer have, but we have other things that have replaced those and are better, even better than those. But I took 4 Restore and Facoidin. I had accelerator for Skolin, and then I added the age pill a little bit later, and Balance D also. I was taking Balance D, which is an amazing supplement. I love it. So I was taking all of those to try and help balance my body, for one, because I felt like my body was probably way out of whack, and then to get rid of weight. And I lost 24 pounds in 4 months of taking the supplements, and I didn't even really have a strict workout program. I have horses, and so my horses kept me pretty busy as far as exercise goes. I was cleaning horse stalls and riding horses and things like that. And then later on that same year, I started running and getting into that. But before I even started running, I was just cleaning stalls and taking my supplements and trying to eat a little bit better, listening to the doctor's calls and getting as much information as I could on balancing my body. And I feel like through balancing my body, Facoidin, getting rid of toxins, the 4 Restore, I know, gave me lots of energy and helped a ton. I still take 4 Restore. I love it. I don't know what it is about it, but it helps me a ton with energy. And I feel like if I don't take it, my energy level is a lot less. And so I feel like it really helps my body balance, building lean muscle and things like that. So now my goal, I've lost the weight and I've been able to actually maintain. So that was the first year I came in and lost 24 pounds. And then now I've been just maintaining and trying to build more lean muscle. And I'm going to the gym, and I have a program that I'm been working on once I can figure out how to not pinch my back when I load hay bales. But I've been working towards that goal of just leaning up. And so I'm really excited that we have Sizzle Ripped, and I'm looking forward to seeing what the next several weeks of really being consistent and going to the gym and working towards that goal. I'm taking 4 Restore and Sizzle Ripped. I'm still on Facoidin, Eternity. I take Eternity also. I use Sizzleline. Sizzleline was another one that I had used to be a meal replacement when I lost my weight. And I'm still doing that also. I'm trying to think of the other ones that I'm taking. Oh, Balance D. Balance D is incredible. I love it. It keeps me so regular like it's supposed to. I feel really good when I take it. So I'm really looking forward to using the new and improved products. I take the age pill to further my my fitness goals as far as building lean muscle and really slimming down and building that muscle.
Well, I'll tell you what, the products you're taking are great for weight loss. You know, the age pill, it helps making sure that you clean out that glycation, that lipofusion, gets the cells so they're working right. And like Tom says, it bumps up the energy. It bumps up the hydrogen production within the cell by supporting all of the structures that you need to have health. And then you look at the balanced D, keeping the gut in shape. And like Katie and I are going to be talking about fiber here in a little bit, in an hour. And balanced D has that fiber to fill you up and kind of give you that feeling of fullness. The same thing with Sizzling. And Sizzling, doesn't it just have an awesome taste too?
Yes, it does. I have tried other protein, like healthy shake drinks or whatever you want to call it, and this absolutely does have a really good taste. I like the chocolate. Chocolate's my favorite, but the vanilla, I can drink the vanilla too, just by itself, or I'll make the vanilla into a different kind of shake, like put some peanut butter or something in it to just give it a little bit of extra something. But I love it just on it. I can drink it in water, where I've never been able to drink anything like that in water. I can drink it in water, and I love it. Tastes good.
Yeah, you bet. I totally agree with you. Well, I know you got to run. You got some other events that you got to do with your kids tonight. Thanks for sharing it. Before you go, just quickly, I know that some people here, they're really into horses. Melanie's into horses, and I know that Katie's into her animals, into her pets. What are you doing with your horses? You're working with Sisel with some products for your horses, aren't you?
Yes, I have 2 horses, and I just recently found out one of them has this disease called navicular, and if you own horses, you'll know what that is, but it affects a little bone in their feet that's right connected to all their tendons, and I have 4 horses, and 2 of them have it. One of them is very advanced, and so we were doing injections from the vet, and they were working, but now they are not, which is pretty typical. You can only inject them so much before it just stops working. So today our farrier came out to shoe them, and he had the partial leg of a horse that he had. And he took it so that it's a diagram so I could see, and he showed me exactly what this disease affects and how it affects. And so today I have even more hope that the age pill could help. And so I'm really excited to start her on the age pill, especially my advanced horse, the one that's more advanced in this disease, to see how it will affect, because I know how bad she is, to see how in the next several months could possibly help, because it's the tendons in there and the cushions have just been damaged. And so I'm thinking, with the age pill and the stem cell reproduction that it helps with, that who knows, maybe I've got some hope that this could possibly help her. And if it does, that could be a really big, huge thing for horse people because navicular is fairly common, and they don't know really what causes it, and they don't have any way of curing it or taking care of it. It's just trying to manage it to keep them from being too sore. And this horse is very, very special, and she's worth putting as much money as I can to try and figure out something. But even this horse that we just found out, if I can give it to her and keep her from advancing like my other horse did, then I'll be just blown away. It'll be awesome.
Well, thanks for sharing that. Thanks for sharing your story, and congratulations on all the weight loss. How fantastic is that? I mean, folks, if you're listening to this online or listening to the recording, I mean, holy cow, can you imagine losing 24 pounds? I mean, Jessica was never, fat like me. And so, she just had that little bit of baby weight to take off, and now she's got it off and she's maintaining. How many women wouldn't love to have that happen? Jessica, have a great weekend, and thanks for being on with us. We appreciate it.
No problem. Thanks.
All right. I'm going to run up to Melanie Ward now, and the reason I'm going to run up to you next, Melanie, is because I know that you're into horses as well.
I sure am. Love them.
Bet. Will you tell us your story? What's been going on up in Michigan?
Well, should I start with the history of why my back's such a mess?
Let's go there.
I rode horses all my life. I've been riding since 8 years old. Got my first pony when I was 9, and just love horses. But I joined the military in December of 1987, and I was trained to be a jet engine mechanic. I actually tore engines apart and rebuilt them. And me and my buddies, we were asked to remove an engine from a test cell. And there was 2 of us on an engine stand 15 feet high. And there was a hoist operator that had a hold of our propeller. And the propeller was stuck on the engine shaft. And I just turned around to the hoist operator. And when I turned around, the propeller swung off the engine shaft and hit me in the backside. It was a miracle. I lifted my feet. I jumped over about 6 to 8 inches of tools that were at my feet. And I fell 15 feet, but I landed on my feet. I stood up and I kept working. It was shortly after that I couldn't walk. I was put on light duty. The progression was pretty severe. The highest, strongest of pain meds at the time was given to me, but I was still not able to walk. And I was discharged with 2 herniations in my back, one in my lumbar and one in my thoracic. So throughout the years of my life, that was just February of 1991. I gave birth to my first child in 1993, and it was the last child I had. I had a very difficult time carrying her. Spent a lot of time getting carried to be put into bed. And I just had an awful lot of pain throughout my years. In 2000, I went down. My right arm was stuck to my side, and I couldn't move it. Medically, they tried to put a neck brace on my neck, and the pain was excruciating at the time. I couldn't even wear it. So I sought after chiropractic care. And for 10 years, chiropractors kept me out of the medical community. Really relieved an awful lot of pain. Then in 2004, I started to lose control of my legs. So, yeah, in my right arm, I couldn't move my right arm. So they took disc out of my neck in 2005, 2 of them, and they plated my neck. And then in 2012, I had lost mobility again on my right side and lost control of my legs. When they went, put me in the hospital to remove 2 more discs, my spinal cord was so impinged, my heart rate and my respiration was so slow, they had to unplug me from monitors. So this was in 2013. I moved to Michigan in 2015, and I was out of breath with every step that I took. By this time, I was diagnosed with facet joint disease, which basically means your facet joints are rubbing together. I had radiculopathy, extremely painful in my legs. My toes felt frostbitten. I had shooting pains through my feet. I'd be walking along, and then all of a sudden, I couldn't walk. There was so much pain in my ankles and my feet. My shins would burn. My knees gave out. My lower back gave out. My hips were just so weak from the damage, the fall. Often I couldn't walk. So here I am. Somebody, Elsie Stoltzfus, sent me the coffee and the fire and iced tea. At this time, I'm also taking 15 painkillers a day. I had a lot of other medical things going on. I was getting breast biopsies every 6 months. I was getting treated on my lips for precancer. And then my doctor told me I needed a biopsy. But Elsie sent me this fire and iced tea. It was really what got me excited about Sisel, because I had energy and I could go until 10 o'clock at night, where because of everything that I was going through, I was ready to like hit the bed by 1 o'clock in the afternoon. I was just so exhausted and tired. So that's what really got me excited about Sisel. And then when I started drinking the coffee, I threw away all my painkillers, 15 of them in the trash, cold turkey, no side effects. Yeah, it was just absolutely amazing. So, you know, I started building the business. I got the renovator, and I think within the first month, the leg pain was gone. I had no nerve impingement in my lower back at all. And so I've been just building Sisel. And when I did a little research on my blood work, when they told me I needed a bone marrow biopsy, I have had leukopenia up in, I started Sisel in 2015, but I had leukopenia up until this year. It's the first year I've been leukopenia free. All my blood work's perfect. And I count that to the H pill.
Yeah.
Because that's really what, yeah. So I do have perfect blood work now. It's been just absolutely amazing journey, Dr. Kirk. They told me I'd be in a wheelchair by the time I was 40 years old, and I'm 49 now. So.
All right. Well, let's prove
my goal today.
Right. Well, let's prove they told me I'd never walk again.
And you know what?
They told me I'd never walk again.
Right. And I love your story. You know, Dr. Kurt, you give me so much hope with your story, because when you say you get better year after year, and what's it been, 13 years now?
11.
11? Well, I'm looking forward to 11 years from now. I'm sure I will continue. But my goal is to get people on the products before they had surgery, because I've had 2 neck surgeries, and can I just say it's a pain in the neck?
You got that right. You got that right. Yeah. Well, I'll tell you, Melanie, I know that you still have some problems, just like I did when I first got started. But your body gradually builds, and if you listen to me describe how the age pill works, your body can only repair a little bit at a time. So a little bit over here, a little bit over here, a little bit over here, and gradually it'll catch up. So there's hope for you. There's hope for you.
Well, I'm looking forward to the next 30 years of my life then.
All right. Well, we'll see you. We'll see you along the way. We'll have you on the call maybe once a year for the next 30 years.
That sounds awesome, Dr. Kirk.
All right.
Thanks for having me.
Thanks, Melanie. I really appreciate your story. All right. Bye now. All right. Well, let's run down to Debbie. I know Debbie has a story that this is a story that not just life changing, but life saving. Debbie, you're live.
Hi, Kurt. Can you hear me?
Loud and clear.
Can you hear me? Really?
We do.
Good. I wanted to say that I was diagnosed in 2013 with stage 4 ovarian cancer. The doctor gave me less than 20% chance of making it. Didn't think I would even make it till Christmas. And the day I got diagnosed, I called Tom Auer. I said, Tom, I've got stage 4 ovarian cancer. He said, that's not good. I said, I know that. So he told me to take the Triangle of Life. I beefed up my Fucoid, and I was drinking a bottle maybe every 2 days for a while. And it's 5 years, and I just went in for my 5-year checkup, and the gal said, I don't even know what to do with you. I've never had anybody with that much cancer still be here in 5 years. I said, I told you I was going to be. So what
a great story. So you had a 20% chance of being Christmas, and here you are 5 years later.
And I'm cancer-free. There's a cancer marker for ovarian cancer. It's a CA-125 number. Mine was at 3,400 when I went in and found out I had cancer. It's now 12. And normal is 35, so I'm very blessed.
So it went from 3,500 to 12. You're talking 12.
Right.
Holy cow.
I know. 3 weeks. I really beefed up the Fucoidin and everything that Tom told me to take. And after one round of chemo, it went from 3,400 to 1,700. And Tom said, that's amazing. You should be on the cover of all the journals. And he said the drug companies would never allow it.
Yeah.
So I feel very, very...
And I bet the doctors haven't even offered to put you on the cover of any magazine.
Oh, no, absolutely not. They said, wow, you really did good with the chemo. They can't believe that I'm here. So
it was the chemo. It had to be.
Oh, yeah. The poison that has all the side effects,
That's right. Well, folks, I mean, if you're listening, the thing that I'm going to say is that we can't say cure. We can't say treat. All we did is we gave products that Debbie took, and it helped improve her health. And we basically treated her body. We treated her body as a whole. We didn't treat any disease. And as a result, here she is 5 years later.
Absolutely. Blessed.
Praise
blessed.
The Lord, huh?
Absolutely.
And you're ready to spend some Christmas with your grandkids, I bet?
Oh, absolutely. Yeah, we're here to enjoy it. I'm here for a reason. I tell everybody every day is special.
There you go. Well, that's exactly it. My mom and dad, they were facing the same sort of thing. And Dad went to Mayo here like 3 months ago, and they told him that they can't find cancer anywhere in his body, right? The chemo worked for my dad, too.
Yep. Isn't that amazing?
All right. That chemo, it really works. All right. Well, thanks, Debbie. I really appreciate it. I'm gonna run over to Susan now and have Susan share her story. And Susan, how are things over in Massachusetts?
Cold.
Cold? All right. But Sisel is sizzling hot for you over there, isn't it?
Oh yeah, definitely. And I love what Sisel has been able to do for me, because I did need to take off some weight, and I was able to do that. And like some people believe you need to do it quickly, but with Sisel I did it slowly, about 3 pounds a month over about 10 months. So I thought that was really awesome, and I started to feel so healthy without that weight on.
So you lost 30 pounds.
Yeah, I think it was around that. I was 150. Well, actually, I lost more than 30. It was like between 35 and 40. And like a lot of people thought I was too thin. I didn't.
Yeah. How long ago was that?
I've been in Sisel 6 3/4 years now. So this was like I took off the weight about 6 years ago.
Yeah, and you've kept it off for 6 years?
Yeah.
Excellent. That's a great part of the story, because you take a look at people like Oprah, you take a look at people like Jenny Craig, right? They up and down, yo-yo type of effect. Here you are, you're better than Jenny Craig. You should put that in an ad. Better than Jenny Craig, ?
Right.
Right?
And and I was using the Triangle of Life, and I started using the age pill shortly after it came out, although I did stop using it, and I have some left that I started taking again. Although both times, like the first day I was on it, the main thing I noticed is I had a hot flash, and I'm like a decade past that.
Yeah. Well, it's not really a hot flash. It's a flush, but it probably feels a lot the same.
Yeah, because any woman who's like past 50 or so will know what that, well, in a way 45, because I had my first hot flash just before I was 45, and I had just gone on the internet, and at first I did not know what that was. Because I thought it had something to do with something new in my life, which was a computer, internet, etc. Then like a month or two later, I had another one, and I said, oh, I know what this is.
Yeah, from the niacin.
Yeah, I knew it wasn't being online and all that.
Well, what products were you taking when you lost the weight again, if you could tell everybody?
Well, the Triangle of Life, the energy thing, the Sizzle Pops as I needed them. I didn't bother with the drink, but now that you use it for breakfast or whatever.
Oh, the Sizzling, yeah?
Yeah, the Sizzling. I didn't bother with that.
So
And the thing was, I was like in 2012 when I joined, my dad was still alive. He got hit by a bus in May of 13, and he was killed.
Oh, no.
So, and my mother's been in a nursing home since 2010 here in Melrose until 2 years ago. So she's in a bordering city, and I'm not able to see her as often as I used to. But so anyway, I used to get a lot of walking in, like she was first in one that was in a street behind where my dad lived. So there was a shortcut I used to use, and he would use as well, unless it was winter, to get to his place or to her nursing home. And I was the one who always did the changeover of her clothes, because I didn't want to keep all her clothes at the nursing home. So I'd have them at Dad's. Of course, I now have them here at my place.
Mm-hmm.
So I'd walk back and forth, and that also helps, because I never learned to drive. I had no interest in that. So anywhere I've gone, I've either walked. I used to ride a bike. I'd like to get a bike again so I can pick that up again. Or I take a bus. And then there's always still some walking anyway.
You bet.
So that always helps.
Yeah, and the walking's going to help you keep that weight off. So, well, good.
Right.
I'm glad you hear the story.
And I live on the 3rd floor of a house, so I have 4 flights of stairs to walk up. Plus, well, if you come into the house, the stairs coming up to the porch, so that helps as well.
You bet it does. You bet it does. Well, and I'll tell you, you're on the right products. As a physician, I've used a lot of nutritional products over the last 33 years, and I've never found a company that works like Sisel. You know, where I can recreate the results time and time and time again, and that's what I really love about these products. I'm working in a couple of clinics right now with stem cell patients, and we can improve the results of the stem cells by almost 40% by using the Sisel products.
Awesome.
Yeah. Well, Susan, thanks for sharing your story. I look forward to having you back on again, and we'll just you know, just even if it's just maintaining. How exciting is that? I'm in a journey right now. Most people know I'm overweight, and my son says I'm obese. I say no, I'm not obese. I'm just fat, but I want to lose 50 pounds. So I'm working on it. So you and Jimmy O'Keefe, you're my inspiration.
Okay.
All right. Good. Thank you. Have a great weekend. And
welcome.
If I don't talk to you before Christmas, have a Merry Christmas.
You too, and Happy New Year. Happy
New Year. Thank you. All right. Well, I'm going to run over here to Australia and talk to Katie down there. I mean, Katie. Talk a little bit about that flushing that you get with niacin. I know you've kind of investigated a little bit. Describe it a little bit for people that maybe are listening and hearing about it for the first time. What actually causes it, and how long will people experience it?
Yeah, so the niacin actually can cause the flushing. It doesn't last that long. When the flush comes on, you can feel your skin getting kind of tingly, feels like sunburn a bit, can be itchy, and your skin on your face can feel quite tight. But I noticed that just before it happens, I have a mood boost. I feel elevated mood, and that happens just before I feel the flush come on. And then when the flush comes on, I've also noticed at that time if I've had any like back pain or musculoskeletal pain, any injuries, it really relieves the pain because it's getting the blood pumping and flowing, and it just really loosens up the body. It's actually quite good. I mean, aside from the probably slightly annoying having the skin itchy, but then after about 10 or 15 minutes, it'll pass, and you just drink plenty of water. And so it has many benefits, the flushing effect. Some doctors do use that specifically, and correct me if I'm wrong, Kurt, for treating cholesterol and other conditions. Some doctors use it as a form of treatment.
You bet, because it opens up the arteries, the little capillaries, and gets that stuff to flush out of the system. You bet. You bet.
So, yeah, it's great.
Yeah, one doctor that I talked to, he actually said that the flushing was beneficial, that they wanted it, and they would basically force feed people niacin. It was before we had the type of niacin that we use in Sisel, but they would force feed it because they found that it would flush out the system, and it would lower the risk of skin cancer. And I thought that was pretty amazing how they used to do that. But again, we can't make those claims. You know, I'm just saying that's what this doctor told me that they did, right? And we have to be really careful on not making any type of medical claims. But that's what they did in their clinic.
Well, yeah.
Yeah. So, you know, Katie, I know that you talk to a lot of people, and so I want to bring up a couple of photos here. I'm going to bring this one up first, and here, hang on. Let me go here and share this photo. This is a testimonial of it's a testimonial of somebody in your organization, isn't it?
Yes, that's right. So Leanne's, I did an interview with her last night, and her brother Anthony started taking the age pill and has had nothing short of dramatic results, and he has personally found it to be quite life-changing for him. So I did a recording with her last night because she's working today, and so she was sharing her brother's story. So I thought it was really interesting for people to hear what happened.
You want me to play that recording?
Yeah, that'd be great.
Hi, Leanne. Thanks for joining us. Hi, Katie. Nice to be here.
Can you hear that all right, Katie?
So you've got
It's a bit soft.
testimonials to share with everyone regarding your brother.
It's better?
Yeah.
It's muted.
Oh, hang on.
And other problems with his skin and all sorts of things. So I suggested to him 5 months ago to try the age pill, and he's very open to trying something that will help his condition more. So he has, and he's just had a magnificent result. I actually had his wife text me 4 days after starting the age pill, and she just said, "Lee, I think we're on to something here." So she had noticed something within 4 days, just in the way that Anthony was looking. So it's really helped him enormously with his skin. He was starting to look like a really, really old man. His skin was terrible. He was always tired and had very cloudy thinking, the numbness in his feet, all that sort of thing, bad circulation. So after 5 months of being on the HPL, I asked him how he was going, and he's just really wrapped in what's been happening. His skin is so much better. He looks 10 years younger. He just looks terrific now. He's got a lot more energy than what he had. He said that he's thinking a lot clearer, more clarity, and the feeling in his feet is enormously better. Wow. Which is a brilliant thing for a diabetic. So he's just started to go on to the Triangle of Life now. The Spectromax, the Trinity, and the Fucoidan. So that's been probably 3 weeks, I think, now that he's been on that. I haven't actually asked him how that's going yet, but I'll do that soon. And his wife is also on the age pill. When she saw the results Anthony was getting, of course she wanted to get on it. Yeah. And she said to him, "You know, can I please have some of yours?" And he said, "No, you have to get your own." So, yeah, so Sim's got her own, and she's looking terrific too. Her skin looks so much better. She's a very thin person, and she was starting to look really drawn, and now she just looks healthy. She's got a glow in her skin again. She's just looking, really good and lots more energy. So, yeah, it's been really fantastic for my brother with the diabetes, and I'm so happy about that. And his wife's getting the same sort of result. Well, so just really life-changing story, really. Oh, it is. Because diabetes, everyone knows, just affects your whole life. His blood sugars have been less erratic. You know, they're normalising, so he's not having those hypos like he was getting. He's having to use less insulin because of that. He's just, so you know, his body's just working better now. It doesn't cure diabetes, but it makes the body function better so that the impact of diabetes is sort of lessened, I suppose you could say. Fantastic. Well, thank you for sharing that. That was very valuable, and I really appreciate you taking the time and allowing you to share it as well. It just can make.
Yeah, what a great story. I mean, holy cow, his diabetic neuropathy is gone, his blood sugars have improved, and look at him.
I know, incredible. This is the most dramatic picture I've seen. I mean, that is absolutely phenomenal. He literally looks 10 years younger, Kurt.
He looks like he's you've shaved 20 years off his age.
Yeah.
Wow.
Incredible.
Holy cow. And he's probably one of those guys that really doesn't even care that he looks that much better. No,
he doesn't. He's happy that he feels better.
Yeah, exactly. You know, so you know, the next photo here that I'm going to share, let's see, is, hang on. This is a story that I want you to kind of share with people. So it's just it's some text message. The only thing I see right in the middle of the screen is somebody's telling you the libido is up.
I knew you would notice that bit. Typical. Yeah, so just a lovely lady, Marie, and she started trying the age pill, and she was so excited. She sent me a text message, and these are just so great, Kurt, to get these messages from people, and this is why we do the business, because of the results people get. They're life-changing. They just make such an impact. She just said to me, "Hi, Katie, things I've noticed. My skin feels softer. Does this stuff also help with sagging skin?" She says her neck skin feels tighter, and yeah, she even says, as you've noted there, her libido's up. And I said, yes, it helps with skin everywhere. Excellent. So then I asked her, you know, would you like to be added to the team calls? Of course, she said yes. She said, oh my God, this stuff is amazing. So if you go to the next picture.
I'll do that right now. Hang on. And hang on. I'll bring up the next photo, which is this one. Oh, that's the same one. Hang on. That one. Oh, why is it doing that, Katie?
Oh, it's okay. I'll read through it. I've got the next one here.
Okay.
Yeah. So the text kept coming. What was amazing about this is that I got the first text, but then they kept coming. So let me. She said she's let me just open this here.
There, that one.
I'm now doing 3 morning and night. Yeah, there we go. I'm now doing three morning, 3 later. I may, she wants to buy some more, obviously. Like, wow. I said, I know it's brilliant. She's like, I'm like, what? WTF, laughing. Then she says, my neck, turkey neck is gone.
So that part that you scratched out there, is that where you were talking about the libido?
Oh no, she was putting her her email address, Kurt.
Hey, I'm a guy. I'm still on paper.
Yeah, your mind. I know where your mind's at. So then she goes on to say that her friend's interested, and I said, well, great. You know, if the product working so great for you, why not get it for free? She says, sounds great. She says, this stuff makes me feel like I'm a kid again. I mean, it sounds like she's reading the promotional material from a brochure, but actually she didn't read it. That's actually genuinely how she feels. She says, is that how it's making you feel? She says, I said, yeah, it makes you feel younger and happier. She says, yes, I'm dancing. I'm not even a dancer. She says, I feel so happy. I don't even yell anymore. She says, I'm not yelling. So she noticed that she's not even feeling like angry like she normally does.
That's probably why her libido is up. That's probably why her libido is up. She's not yelling.
Yeah, well, if you're not stressed and you feel more relaxed, obviously that's going to have an impact. So I just thought, you know, what a great testimonial. And it's those sorts, you know, imagine getting those sorts of text messages when somebody's taking the H pill and they're so excited, and, you know, really turns your day around. It turns their life around, and it's just fantastic.
Yeah, I'll tell you, you know, what that's exciting when you start seeing stuff like that. I mean, some people, like, I'll get a call from people and they'll say, well, Kurt, you know, I've been taking it for 3 days now. I don't notice anything. I'm like, I say, 3 days? How long have you been sick? How old are you? And they'll say, well, I've been sick for 2 months. And I say, and you want to have it better in 3 days? I said, holy cow, just hang on.
Yeah.
Because it works in everybody.
Yeah, and well, she's about, I think she said she's 54, but as soon as she started taking in the next text message, she says, I'm going for a run now.
She's what? She's
going for a run.
She's going for a run.
Yeah.
Wow. That's fantastic. That's fantastic. I really love what we get to do. I mean, holy cow, we get to just work with people and make them feel better. I got one more testimonial that I want to play, and then I think we should make an announcement tonight, Katie, after that. So let me play this last testimonial. This is my friend in Bismarck, North Dakota. Lee wasn't able to make it on the call, but I met with Lee a couple of years ago, and this is his story. So, Lee, are you there?
Yes, I'm here. Okay, great. Well, welcome to the call tonight, and you know, we've got a lot of people that are listening, and people across America are just really, not just in America, but across the world, are really finding out about Sisel and finding out how excellent these products are. And I know a number of years ago, points, what did your doctor say when they saw that?
Well, the first time I went in, I don't know what happened, like they elevated, and then suddenly they came down, and they were really shocked. And I've been cut back on a lot of the drugs to now to the point where I no longer take them.
You no longer have to take the pain meds and the cholesterol med.
Right.
That's good. And you said the heart.
I don't know why that keeps shutting off.
Doctors say when they saw that.
Definitely. Because cholesterol medications did not agree with me too well. So.
Well, and all the news on cholesterol. I mean, a report came out yesterday on statin drugs, and they said that it increases your risk of Alzheimer's when you take statins.
Wow, I never heard that one.
Yeah, it was just a study that I read yesterday for the first time, and so I mean, I guess in my opinion, I mean, you're doing the right thing. I mean, get off the meds and work with your doctors to get off the meds and if you can do it with natural products like this, holy cow.
Oh yes, I'm very happy with it, and it, especially like with the arthritis in my hands and stuff. I was to a point where when I came home from work, I couldn't even close my hands. They were kind of stuck halfway closed. I couldn't even close them. And then, like you said, I had several treatments with you on with my shoulder and my knee, and I have had no problems now whatsoever.
Wow. And would you mind sharing with everybody, how old are you?
I just turned 63.
Just turned 63. And so you were right around the age of 60 when you got started.
Yes, sir.
You know, and the reason I asked that, Lee, is mainly this, is that I think a lot of times people people think that, oh, it's too late for me, I can't do anything. But I remember your shoulder, man, you had trouble just lifting it up high enough to
Yep, lots of trouble with that, yeah. I believe that was called what, the PMF?
The pulsed electromagnetic field therapy, yeah?
PEMF, yeah.
Yeah.
That, and along with the, I think Fucoidan had a lot to do with it too, along with the Renovator and the 4 Restore that have been taken.
Yeah. Well, now the new studies that came out this year on not on our product, but on the brown seaweed extract that's called Fucoidan, they found that it mobilizes the stem cells. It helps to mobilize the stem cells to go to the areas where they're needed the most.
Oh, wow.
Yeah.
That's very interesting. So it'll actually, like the cells that are needing work, it goes there?
Yep, it directs them to go to the right spot. So, a couple of us that are working with stem cells, with these stem cell clinics, we're actually recommending the Fucoidan along with the age pill to actually make the stem cell, the regenerative medicine, actually work better.
Yeah, I've noticed that too. I think what's it been now, a little over a year now it's been out? Or 2 years?
Yep.
And since then, where I used to have, how gray I was.
Yeah.
It was like my hair is like silver white.
Yeah,
it actually looks dirty now.
Oh, wow. So you get some color back in it.
Yeah, color's coming back in my hair. I've only got a few in my eyebrows, just a few gray hairs now. So my eyebrows are just about all the way back.
Wow, isn't that exciting?
Yeah. People have even noticed it, Are you doing something? Are you dyeing your hair or what? And I says, no, it's just coming back.
Wow. I had somebody accuse me of that last year. They said I was dyeing my hair, and I'm like, no, I wouldn't do that. Well, yours keeps coming back. It's got a little bit of grayness, but it's not as bad as it used to be.
Yeah, mine's definitely kind of a dirty gray now instead of just all gray.
Right.
Lot, that age pill has been phenomenal. My eyesight, I don't even, my TV is like 15 feet away from me, and I no longer wear glasses.
Wow. You don't even have to wear your reading glasses.
No, well, I never had reading glasses. I had actual glasses.
Oh, you had actual glasses and you don't have to wear them?
Yeah. The only time I put them on is for a really long distance when I'm driving. But
Wow, how exciting is that?
Typically, for watching TV now and stuff like that, I don't even wear nothing for reading or anything because I had bifocals for that.
Yeah.
Tape measures, I can read them at work now.
Oh, there you go. Well, that's got to really make you feel a lot younger, when you got the grandkids there, your grandsons, you're able to get down on the floor and play because you can bend your knee, you can, throw a ball and play catch with them. And now you're starting to look like a younger version of a grandpa.
I feel like it too.
There you go.
Lots more energy, and I'll tell you what, though, it's like I don't even sleep as much anymore. When I hit like 5.5 to 6 hours, I'm up and going.
And you have plenty of energy.
I've got the energy for the day, yeah.
Well, great. Well, Lee, thanks for sharing your story with us tonight, and I'll get a copy of the recording to you once I get it done later.
Lee, I met him a couple of years ago, and when I first met him, he couldn't move his shoulder. Like if he wanted to shake your hand, he'd go like this, and he'd move his whole body. Yeah, that's how bad it was, Katie. And so I started working with him, and within a month's time, he was lifting his arms up. He was lifting up over his head, and pretty amazing. Pretty amazing. And then his cholesterol numbers, the part of the recording that we weren't able to hear is that his cholesterol numbers dropped. He was on cholesterol. He was on statin meds, and he was able to get off the statin meds, and he was able to get off the painkillers, on narcotic painkillers. And he's been able to do all that. And he's working with his doctor. Again, we can't tell you go off your medications, anything like that. We can't diagnose, we can't treat. But all I say is that, hey, if you got some medical problem, go to your doctor, find out what's wrong, and then take a look at what we have, because what we have might be able to help along with what you're doing. Or like my mom, when my mom had the plugged arteries in her neck, when her carotid arteries, they were 90% plugged. And I just asked her, I said, hey, Mom, go talk to your doctor. And before they go do the surgery and take the artery out of your neck and put a stent in there, ask your doctor if you can just try a couple products for a few months. And if it works, you can avoid the surgery. And they said, yeah, we'll give you 3 months. So my mom took 3 months, and she followed the regimen that I put together for her with her doctor's instruction, and they watched her. And over the course of 3 months, that artery opened up, and she didn't need to have the surgery.
Wow.
Yeah.
It's just fantastic.
Yeah. Yeah. And that's, so I'm excited and about the products, and it's amazing. Just, you hear these stories. You hear people losing weight, 24 pounds and maintaining it, and losing 30 pounds and maintaining it, lowering the cholesterol and helping to get better cardiovascular function, getting rid of chronic pain like we heard from Lee, and like what we heard from Melanie, and helping with some really life-threatening illnesses like Debbie. Right? And what it's doing is it's just making the body so it does what it's supposed to do. We're not treating anything. We're not treating anything.
The body's designed to be healthy.
That's right.
Helping the body help itself.